Vivitrol, naltrexone used for opioid addiction. History of Vivitrol. 1984, the FDA said you can use oral naltrexone to treat opiate addiction. 92, 2 studies that showed you can use the same stuff to treat alcohol dependence. 94, FDA said, yep, go ahead and do it. The studies came out and the FDA said, yes, you can use naltrexone to treat alcohol dependence. 2006, injectable Vivitrol for opioid dependence, and it came full circle. 2010, FDA said you can use Vivitrol to prevent relapse to opioid dependence after detox. So again, came full circle back to it. Facts about Vivitrol. Extended release naltrexone. Once a month shot in the butt. Full antagonist, blocks the opioid receptors. If you try doing opioids, there's no euphoria or pleasure. You just wasted your time, money, and effort. And oh my God, now I got to go talk to Olstein about this. I got to talk to the counselor. So again, it discourages abuse. No physical dependence. And so there's no withdrawal symptoms when you stop it. Doesn't provide pain relief. So if there's an issue of chronic pain, probably not a good choice. Because there's no activation of the receptors, for some folks there's a limited amount of control of the opioid withdrawal symptoms or cravings for some people early on. If you can get past a month or so, that ought to settle down. Candidates? Less severe form of the addiction, short history of use, lower level of use. Somebody who's been using opioids after surgery maybe for 3-4 months, 5-6 months. I'm not going to be inclined to put them on Suboxone for a year. I think that's a really good candidate for treatment with Vivitrol once we do the detox. Someone who declines treatment with agonists. There are people who say, absolutely not, under no circumstances. I'm not going to do methadone. I'm not going to do buprenorphine. No way. I've heard all the bad things. Okay, we'll do Vivitrol. Someone who's been abstinent but at risk for relapse. These are somebody who's been incarcerated in jail for a while or after residential inpatient treatment. When they come out, they're going to be at high risk for relapse because they're going to go back into the same environment or they're not in the protective arms of either jail or treatment. They're going to be at high risk for relapse. These are people who are excellent candidates for Vivitrol. Someone who's completed a course of agonist treatment. So if somebody's finished Suboxone, or methadone, but we'll say Suboxone, you've finished a course of Suboxone, we've successfully tapered you off, I pretty routinely recommend a course of Vivitrol because it's the safety net effect. I generally recommend, there's no literature to support that says how long should somebody be on Vivitrol after completing a course of Suboxone. I recommend 3 months. About 90 days, 3 injections. People come out of treatment centers, they say do 90 meetings in 90 days. I recommend inpatient treatment. I recommend 90 days. How long does it take to learn a new habit? About 90 days. So I recommend Vivitrol for about 90 days. The safety net effect is you finish the Suboxone, you're out there, stuff happens. See how professional I was the way I phrased that. Stuff happens. If somebody has a slip and they use, the Vivitrol blocks it, and as I said before, you now have the opportunity to come back, talk to your counselor, come talk to me, see what happened, explore that. And then by doing that, you have a better chance of not having that happen again. Doesn't mean you're not gonna. But by processing it, you're less likely to. And some physicians use it as a first-line, first-time treatment for opioid addiction. There's lots of centers in the country, they leave in Suboxone, and they use Vivitrol. That's fine. Alcohol addiction. Disulfiram, antabuse. Facts. 1951, approved by the FDA for alcohol addiction. It interferes with the metabolism of alcohol. It blocks the second step in the metabolism of alcohol when you drink. Because it's blocked, you build up a toxic product in your blood. If you drink alcohol while you're taking antabuse, it makes you sick. Very unpleasant symptoms. Nausea, vomiting, sweating, flushed skin, throbbing headache, breathing difficulties, blurred vision, confusion. So if I'm taking, back up to this one. If I'm taking antabuse, and I drink. And if I drink and I'm going to get sick as a dog every time I drink on antabuse, maybe I shouldn't drink. So again, it discourages people from drinking. But unlike other anti-addiction meds, it only acts as a deterrent. It doesn't heal any of the damage. And also, it doesn't work if it's still in the pill bottle. So you gotta take it. If somebody's got, I got this, my good buddy's coming into town, I haven't seen him in 5 years. He was my old drinking buddy. I'll hold off for a while because I'm gonna party this weekend. Yeah, so it doesn't work if it's still in the pill bottle. I think I've written one prescription for antabuse, and that's somebody who absolutely insisted, and he said he did well with it. Most folks nowadays, if you do antabuse, it usually needs to be observed, administered under observation. Naltrexone, Vivitrol for alcohol. Review, remember 51 we had antabuse, 94 we started using oral naltrexone for alcohol dependence, 2006 we got the shot. Naltrexone can be taken by mouth as a 1 to 3 times a day pill. As with antabuse, oral naltrexone, it doesn't work if the pills are still in the bottle. So I got people doing oral naltrexone. They got a big weekend coming up. They stopped taking it for a couple days. Extended release Vivitrol, once a month shot again. Full antagonist blocks the opioid receptors. What do opioid receptors have to do with alcohol? I thought it was for opioid addiction. Well, when you drink alcohol, you are releasing and interacting with different neurotransmitters and different kinds of receptors. One of the things that happens when you drink alcohol is you cause a release of endorphins. Endorphins are our body's internal opioids. Those endorphins go to the opioid receptor, same place that heroin goes to. When that endorphin goes to the opioid receptor, dopamine, feel good. By blocking that receptor, by the Vivitrol, by blocking the receptor, it decreases cravings. So, by blocking the receptors, cravings are decreased. Because cravings are decreased, it's less likely you're going to take the first drink. If you take the first drink, and there's a lot of people who like to road test it after they get their first shot, right? If you take the first drink while you're on naltrexone, you don't get the same buzz because the receptor's blocked. So if you don't get the same buzz, you're less likely to take the second or third. Just as with buprenorphine, before I told you that there's a risk with people trying to override the buprenorphine by taking more and more. There's a risk here. You're on Vivitrol or naltrexone, you're not getting the buzz, and people will try to override it and drink over it. And the other problem sometimes for folks is, okay, I'm on Vivitrol, I've taken a drink, oh, nothing. I've taken another one, no buzz. Oh, I'm fine. I can keep drinking with my buddies because I'm doing okay. I can drink that much more. Naltrexone does not block the cerebellum. The cerebellum is where we have reaction time, coordination, things like that. So you can feel okay, get in your car, and be pulled over and blow big, and be very impaired, but not feel as impaired. Vivitrol gives a more constant blood level at a lower total dose. When you take oral naltrexone, you get a blood level and it goes away. Take the next naltrexone, you get a blood level and it goes away. With Vivitrol, you get a peak at about day 2 or 3, and then it levels out and stays steady state for the next 4 weeks. Tails off, and then you get your next Vivitrol injection in 4 weeks. So there's more of a steady state, more of constant levels of naltrexone in the bloodstream with the injection. And if you're taking one naltrexone tablet, that's 50 milligrams. That's the standard tablet. 50 milligrams for 30 days, that's a 1-month supply. You're taking 1,500 milligrams of naltrexone. If you're taking 2 tablets of 50 milligrams a day, that's 100 milligrams a day for 30 days, is 3,000 milligrams a month. Vivitrol is 380 milligrams that lasts a month. So you're getting a more prolonged effect, steady state, at a significantly lower dose. So it sounds very good. Most patients stay on Vivitrol for at least a year. Get it? A year. Cost can be a limiting factor for Vivitrol. It can cost anywhere from $1,200 to $1,600 cash if you have no insurance, except the company knocks $500 off of that. So if at $1,200, which is the lowest that I've heard, it's about $800, $700, $800. I subtracted 5 from 12 if anybody caught me there. $700 to $800 cash a month. For some people, that's just a limiting factor. I have a lot of folks who can't afford Vivitrol. Their insurance doesn't cover it, or they don't have insurance, and they do fine. They do okay on the naltrexone. Of the two, obviously the Vivitrol is preferred, but that can be a limiting factor.